Good morning to everyone present here. The topic for my today's presentation is Aeronautical Dentistry, the Edge of Tomorrow. These are the contents that I'm going to discuss today. It is rightly said that one small step for a man is one giant leap for a mankind. And with the advancement in the technologies in the 21st century, it became possible to send human beings above Earth's atmosphere into the outer space. Achieving space flight enables humans to explore the system and understand the phenomenon that are better observed from the space perspective. Although the possibility of exploring space has excited people in many walks of life, but once we are out of Earth's magnetosphere, we are not safe due to deep space radiation and microgravity. The effect of microgravity and radiation on astronauts' health represents two of the most serious challenges present with the spaceflight environment. Though the dynamic of how astronauts' health system responds to space flight have been widely researched, but much more work in the domain of dental health remains untouched. So here comes the role of space and aeronautical dentistry, which deals with the study of application in the space environment, including the microgravity, hypergravity, and radiation. Thus, this paper aims to review the various dental issues faced by the astronaut and the technologies that can be incorporated to handle these dental emergencies. To identify the studies eligible for this review, a detailed search strategy was developed and applied in the Medline, PubMed, and Cochrane library database. Exposure to microgravity and radiation environment during short and long duration space mission has important medical and dental implications in astronauts. On Earth, usually humans are exposed to relatively low levels of ionizing radiation due to protective effects of the Earth's atmosphere and geomagnetosphere. It has also been reported that bone loss, fracture of jawbone, dislodgement of prosthesis, atrophy of muscle, facial pain, and numbness of the teeth and oral cavity tissue, mucositis, xerostomia, necrosis of soft and hard tissue, oral cancer are all more prevalent in stimulated microgravity and radiation as compared to the normal Earth environment. Normally, bone formation and resorption are in a state of normal equilibrium, but in microgravity environment, due to demineralization, the extent of the bone loss is about 1 to 2% of bone mass per month in space. Loss of bone mass is not uniform throughout the skeleton, but varies at a different site depending on the type of bone and the mechanical load received. The skeletal response in microgravity could eventually lead to significant reduction in the ability of the skeletal tissue to withstand the force of the gravity and to increase the susceptibility to the fracture. Increased bone resorption contributes significantly to raise the salivary state of saturation with respect to the calcium salts and may result in cyalolithiasis. In case of microgravity, there is reduction in overall muscle mass, thus causing insufficient increase in the muscle tonicity during stressful period. It has been suggested that after 4 months of microgravity exposure, the muscle mass reaches to a new steady state. Also, abnormal facial expression, loss of sensation of pain and temperature, decreased tongue and mandibular movements were observed due to fluid mechanism. The effect of stress directly affects the temporomandibular architecture, along with overall reduction in the bone mineral density of the complete body. To avoid bone loss and atrophy of muscle, space crews are currently assigned per day 2 hours of exercise along with pharmacologic and nutritional intervention. Decrease in barometric pressure can impair the retention of the complete denture. Therefore, fixed prostheses are preferred over RPDs. Also, change in pressure in microtubules of the cement layer result in reduced retention of the crown. This is due to expansion and contraction of the porosities on the pressure change leading to the weakened cement. Therefore, it is suggested to lute the crown with temporary cement. It is likely that a dental emergency or at least dental caused discomfort will occur during a long-term space mission, and dental emergencies can become true medical emergencies. Therefore, the use of various technologies like CAD/CAM, scanners, lasers, LEDs, ultrasound, and robotics have been proposed in space and aeronautic dentistry. So, if there is a clinical situation in which astronaut experience pain or discomfort or dysfunction caused by a loss of partial crown or full crown, CAD/CAM and scanners can be used. In this area, intraoral scanning of the teeth and, if necessary, further dental diagnostics can be used. Then this 3D data, which has been scanned, is transmitted back to the earth for the diagnostic support by the expert. Virtual computer-aided design of the restoration and the fitting position is being guided by the earth-based dental lab. Then this 3D data is sent back to the space base and 3D milling of the or printing of the prosthesis is done. This prosthesis is then inserted and fixed using the positioning guide and for the exact placement of the prosthesis. It is then checked by the screw member, and if necessary, surplus of the cement is removed and the occlusal adjustment is also being done. Lasers and LEDs are used in different types, in different ways. A number of different types of lasers and LEDs are approved for the dental operation. It can be used in peri-implantitis case and also for tissue retraction or for impression making. Ultrasound is one of the most cost-effective and versatile form of medical imaging that is being used in the medical field. Imaging technique can be used for both bone and soft tissue examination. It might also be used to image TMJ, bone loss, pathological lesions, calculi in salivary duct, periodontalgia, and detection of the fracture. Robotics is used in a wide range of area, and it is quite appropriate for the surgery. Though no robotic dental surgery have been done up to this time, work in this area might specially focus on how to use robots to manage the examination, diagnosis, and treatment planning. So I would like to summarize this paper by saying that this paper explains the scientific basis for physiological reaction so common to astronauts who experience deep space radiation, zero or microgravity. It also includes guidelines for oral dental treatment in such environment, including the application of the latest technologies available. So, in conclusion, I would like to say that dental emergencies, though have not occurred only infrequently in space flight, such emergencies are typically prevented through the use of comprehensive pre-flight examination and by taking preventive measures during their training period. But as the duration of space flights are increasing and exploration class missions are planned for several months to years, it has become relevant to explore this untouched part of the dentistry. Here are my references. Thank you.